Well, global COVID-19 infections have officially passed the 18 million mark, and health experts say the virus is continuing to spread at an unprecedented rate. 8 million cases were confirmed in the month of July alone, making it the worst month of the pandemic so far. The US has recorded nearly 2 million in the last 30 days alone. Major surges have also been recorded in India and Brazil. The number of cases worldwide is now doubling every 6 weeks. There are dozens of potential vaccines in development, but the World Health Organization warned today that a permanent cure may never be found.
We all hope to have a number of effective vaccines that can help prevent people from infection. However, there is no silver bullet at the moment, and there might never be. For now, stopping outbreaks comes down to the basics of public health and disease control. Testing, isolating and treating patients, and tracing and quarantining their contacts. Do it all.
Well, Europe is no longer the epicenter of the pandemic, but the virus is surging once again in some parts of the continent, and authorities are fighting to keep infection rates at bay with new restrictions. Several cities in France have strengthened mandatory mask policies, and travellers returning to the country from 16 hard-hit countries will now be tested for the virus at airports. Meanwhile, Belgium has seen its number of coronavirus patients in intensive care double in the last month. But some European nations have so far evaded the threat of a second wave. Portugal has reported no new virus deaths for the first time since March, and infections are at their lowest in almost 3 months. Well, let's get more on this with the European public health professor Martin McKee from the London School of Hygiene and Tropical Medicine. Hello, many thanks. Hello, thank you very much for joining us on the programme. I'd just like to look initially at the situation in Europe, because as we were just talking about there seems to be a real disparity when we look at the resurgence of COVID-19, particularly in those countries that were hardest hit to begin with. So if we look at Spain and France, which are grappling a resurgence, but Italy that has somehow managed to contain a second surge of the virus. Why is that?
Well, first of all, I think we need to be careful about the language around second waves, second surges. I think what we're seeing is a resurgence in a number of countries that perhaps opened up before they'd really got the levels of circulating virus down to a very low level. And by easing up, then, of course, it gives it an opportunity to come back. But you are right, there's quite a difference both at this point and as there was earlier on in the year in the extent to which different countries have been infected. But a fundamental point is that I think some countries opened up rather too quickly.
OK, so if you say rather too quickly, if we look at the situation and Spain and France, do you think they lifted their measures too quickly?
Yeah, I think they did. And also the United Kingdom, another example. Of course, Sweden is a separate situation because it only imposed relatively limited restrictions, although the Swedish people did actually reduce their movement quite a bit. I think what we've seen in Italy is the example of having very robust finding, testing, tracing, isolating support systems. Always in Italy from the very beginning, the pandemic was very much limited to a small number of northern regions, particularly Lombardy, particularly badly affected, but also Emilia-Romagna and Veneto to a lesser extent. But there was relatively little disease in the rest of the country. In contrast, in a number of other countries, particularly the United Kingdom, we've seen a much more generalized outbreak spreading to all parts. In France, we're somewhere in the middle with concentration of cases around the Ile-de-France and the Grand Est. And in Spain, it's been very much concentrated initially anyway in Madrid and Catalonia.
Well, if we look at the cases again in France and Spain, now there are localised responses to these resurgences. Now, particularly in France, the mandatory wearing of masks in certain virus hotspots. Would it not just be easier to make the wearing of masks mandatory in all public places, indoor, outdoors, particularly if you look at a case study like that of France, where the information can seem a bit confusing?
Well, we have very good data from Germany where there was an interesting natural experiment where different cities imposed rules on face coverings at different times, and you could see that these were very effective. We do know a lot more about the transmission of this virus now, and in particular how it's different from influenza. The risk of transmission outdoors, providing you're not in very close proximity to somebody else, is actually very limited. The issue is indoors, and any situation in which you're meeting a lot of different people for a prolonged period of time indoors is where the risks really are. Now, they can be, for example, in the meatpacking plant in Gütersloh in Germany, or they can be in some of the accommodation that migrant workers are working in Spain, or garment factories in Leicester in England. But also a lot of outbreaks that have been associated with church services, that sort of thing. So really, I would focus much more on the indoor precautions, and the risk is much less out of doors.
OK, and then just briefly now, young people have been pinpointed as responsible for a resurgence of cases. Now, many of those young people are asymptomatic, but does that mean that they are free of COVID symptoms in the long term?
No, it absolutely does not. And we're now talking about a syndrome where people are calling it a long COVID. And what we're recognizing is that even people who are relatively mildly affected, which is the case with many young people, are often having quite serious consequences. A significant number of them seem to be developing serious consequences later. This is really very worrying indeed. The receptors that this virus binds onto are distributed widely throughout the body. And we're seeing a lot of people, including ones who had relatively mild symptoms to begin with, are ending up with heart problems, with lung problems, in some cases their pancreas with the new onset diabetes and so on. So I think that as we get further into the pandemic, we're going to realize that recovery and death are not the only outcomes. There is a very serious risk from all of the other complications.
Very serious risk of longer complications. Many thanks for joining us on the programme and bringing light to these serious issues.